The nursing shortage. How do we fix it? And equally important, who fixes it? Who must act?
Everybody should act.
New grads need to be supervised because unlike physicians who have residencies, which are paid for by the feds, nurses don't get residencies.
You need the internship to make them feel adequate with what they're doing. They have to feel secure in their work and that someone's behind them and not always be shoved aside. You have to do it because of money situations. Hospitals have to spend a little more money.
That it takes about 17 months for a new graduate to be fully competent. Somebody's going to have to give up some money to make that possible, and the only people who have the money know that they need it themselves.
We are actually partnering with a lot of nursing schools here in Southern California. Our association has helped manage a lot of that, where the mentoring is provided both in the school setting as well as in the hospital. And getting some of the nurses who are in the hospitals on the faculty of the, for the schools of nursing has helped.
We are funding 4 full-time nurse, instructor, and professor positions at the local schools and colleges.
But there has to be more in terms of scholarships. There has to be, especially for those going on in the education, like they did for the teachers. They were doing specific scholarships for the teachers. Well, they need specific scholarships for those going into nursing.
2 factors are very important. Number one, we have the students. That's not a problem here. We need faculty to teach. In other words, funding to hire the faculty. And we do have the faculty to hire. And second, we need the space. We have only 4 classrooms. And we have 550 students.
Well, I think everybody would agree the solutions should include increasing the educational slots. I think that that is really a critical issue. We can't provide healthcare providers until we have more places to educate them. I think you could make an argument that if you have 5 medical schools, that you should have a nursing school associated with each of those 5 medical schools.
If our policymakers, if our legislators believe that this problem is as acute as we believe it is, then they have a responsibility to act. And we have all of these government-funded universities, state universities, state colleges, community colleges, who are continually cutting back on slots, reducing, if not eliminating, the nursing programs. If legislators really believe that this is an issue, then they need to go to those schools that they fund and tell them, this is what we want you to do.
I've been very impressed with what Johnson & Johnson has done to try to raise the awareness nationally about the shortage of nursing and about the image of nursing, because it's a really wonderful profession. If nurses get involved in working on the solution, we can make the difference. I think that sometimes we allow others to actually try to find solutions for us when we should be out there actually creating the solutions ourselves.
I think nurses have to get respect back. I think nurses have to be proud of their profession, and they need to go out, and they are, and say, hey, we count.
I've seen a great increase in number of male nurses in our field versus when I first graduated. It might have only been one male nurses, but now I see a lot more. So, that's a great plus for us.
If we can improve the hospital situation, the staffing, we need to have respect back for the nurses.
To encourage nurses to stay in nursing, I think either legislatively or hospital CEOs need to look into the salary of the nurse to make it competitive with the other professions.
To allow nurses to be professionals again. There will be tons of women and men who would absolutely love this profession if they were given the opportunity to really practice their profession.
The atmosphere they provide for the nurses, the ease of their working, somehow taking the burden of paperwork away. Those will all help. And once you got them, I'll tell you, you fight to keep them,
Mandating safe staffing standards that guarantees that patients have safe staffing and that nurses have a higher job satisfaction because they now can provide the quality of care they were trained to provide, is a very strong incentive for keeping nurses in nursing. It also sends a message to those people who left that you can come back. You can come back to work in a safe environment.
I think as a general rule, though, it's hard to talk about solutions for the nursing profession today without first talking about the work environment. Mm-hmm. And the work environment needs a lot of assistance in creating a more thriving, challenging culture of autonomy for nurses today.
Dr. Reeder did a study at Stanford back in the 70s that demonstrated that where you had good teamwork between the members of the team, you had better care for patients. So when we come out again in the 80s with the magnet studies, which said, you know, you have teamwork and the nurses work well together, you have a better care of patients, you have less turnover, you have all these good things. And finding Linda Aiken, who cited in the Needleman study, went back and redid the study as a follow-up, okay, and said, you know, this is still true. But that means people have to respect each other to be part of a team.